Hi, this is Dave Hoy, back from PHOENIX Rehabilitation again. Today, and for the next few videos, we're going to talk about foot and ankle disorders. And a common one that we often see, and that people often seek medical care with, either a physical therapist, primary care physician, or podiatrist, is heel spurs. People often don't understand what a heel spur is, what causes it, and how to treat it. So we'll talk about some of the basic things today, and we'll talk about more advanced things in the future. So what a heel spur basically is it's an increase in bone growth here on the bottom of the heel, or the calcaneus bone. So patients will often have pain in this area here that may spread up into the plantar surface of the foot. When people seek physical therapy treatment, we try to look at the mechanics of the foot and see what we can do to aid the mechanics to take the stress off that heel spur, or that bony growth. One of the biggest things that we see is that when a patient's calf becomes hypertrophied, or too tight, or too developed, it does not allow for enough ankle mobility up this way, and that stress causes the bone to grow. So simply what happens is this heel cord here becomes so taut that where it wraps around under this portion of the foot and inserts, it's so tight that it keeps pulling away at the bone, keeps pulling away at this calcaneus, and what that calcaneus does in a response to the inflammatory phase, or that constant irritation, is it grows more bone to try to protect itself. And therefore, us putting weight down through the bottom of the calcaneus causes pain. So as physical therapists, one of the biggest things we can work on is improving mobility of this calf, or the back side here, and then improving mobility of the Achilles tendon as well, so we take that strain off. Unfortunately, when people have surgery, simply called a spurrectomy, removal of bony growth, if this soft tissue limitation, or this hypertrophy, does not be addressed, or it's not treated, it's only going to cause that bone growth to grow back. Because again, if we remove the bony growth and we still have the tension pulling on it constantly, it's going to cause more bone growth again, or osteophyte growth, in a response to that. So if you're having heel pain or bone spurs, often what you can do is to try to simply increase your calf length. So just calf stretching would be very beneficial. That's all we're going to cover in this video. In subsequent videos, our next one, we're going to talk about improving mobility of this, and I'll demonstrate some techniques that we can use to improve that. But if you should have questions in the meantime, please feel free to contact me or a PHOENIX Rehabilitation clinic close to you. Thank you.